RSV. At first, it might just sound like a jumble of letters, something you'd see in a medical textbook or hear in passing at a doctor's office. But for parents and caregivers, RSV is a name that can bring real worry, because for infants, it's much more than just a set of initials. For babies, RSV is a big deal. It's one of the most common reasons infants end up in the hospital, especially during the colder months when viruses spread more easily. RSV stands for Respiratory Syncytial Virus. It often starts out looking like a regular cold, maybe a runny nose, a little cough, or a mild fever. Most parents might not even realize it's anything serious at first, but in infants, especially those under 6 months old, RSV can quickly become dangerous. It can cause severe breathing problems, wheezing, and even pneumonia. In some cases, babies need oxygen or intensive care, and sadly, it can even be deadly. Every year, RSV is responsible for sending over 3.6 million children to the hospital worldwide. Hospitals and clinics see a surge in cases, filling pediatric wards and emergency rooms with worried families and sick little ones. Tragically, RSV causes more than 100,000 deaths in children under 5 each year. These are not just numbers, they represent families who have lost a child and communities that grieve together. The burden is especially heavy in low and middle-income countries where access to advanced medical care can be limited. In these places, RSV can be even more deadly, and families may have to travel long distances just to get help. So who is most at risk from RSV? The answer is clear. Infants, especially those born prematurely or with underlying health conditions, are the most vulnerable. But young children and older adults, particularly those with weakened immune systems, are also at risk. RSV doesn't just affect babies. It can also cause serious illness in older adults and anyone with chronic health problems. For families with both young children and elderly relatives, the risk can feel overwhelming. The virus spreads quickly through coughs, sneezes, or even by touching toys, doorknobs, or other surfaces that have the virus on them. Daycares, crowded homes, and public spaces can all be hotspots for RSV transmission. But there's good news. We have powerful tools to help prevent RSV and protect our children. With the right steps, families can reduce the risk and keep their little ones healthy. The World Health Organization now recommends monoclonal antibodies for babies at high risk. These special medicines can help prevent severe RSV infections and keep babies out of the hospital. There's also a vaccine for pregnant women, which helps protect newborns during their most vulnerable first months of life. By getting vaccinated during pregnancy, moms can pass on important antibodies to their babies. Simple steps like frequent hand washing, cleaning toys and surfaces, keeping sick people away from babies, and staying up to date on immunizations all make a big difference in stopping the spread.